Welcome to our latest series, our latest session on Scientists Answer Your Questions, a series of free webinars which are sponsored by the participants in the Vitamin D Action Project of Grassroots Health. Today I have the absolute pleasure and delight of introducing another major advocate for vitamin D, Dr. John Cannell. I met John about 7 years ago at this point in time. And Dr. Cannell has spent over the 10 years writing and researching about vitamin D, has written influenza and vitamin D papers, and has published articles on autism and vitamin D, which really is our topic of the day. If you take a look at that green section up there, it says the path towards effective prevention and perhaps a treatment effect if adequate physiological doses of vitamin D are given is so simple, so safe, so inexpensive, and so readily available and so easy that it defies imagination. And I want to add, it defies imagination sometimes in our advocacy about why the world hasn't totally adopted this yet. So Dr. Cannell, it's all yours. We are very eager to hear your presentation today.
Thank you, Carol, and thanks for having me. Vitamin D and autism, and I'm John Cannell with the Vitamin D Council. I think Sir Isaac Newton said it best, and this is the principle of parsimony, where the simplest explanations are probably the correct explanations. Whenever I think about theories, I always use the principle of parsimony. One of the things that is fascinating about and tragic about autism is the incidence curve that is seen. And now the geneticists will tell you this is just because it wasn't detected down here in the 70s and 60s. But if you think about that explanation for a minute, first the geneticists have to say that because autism is highly heritable, and there's no way to explain an exploding incidence of a highly heritable disease except by saying it was not detected. But autism is not a subtle disease. These children don't speak, they don't look you in the eye, they're loners, they often go into temper tantrums. To think that the parents and the doctors and the teachers all missed this in the 50s, 60s, and 70s has no face validity and is in fact ludicrous. The fact is there's a dramatic and increase in incidence of autism for reasons nobody understands, to the point where it's now 110, one out of 110 children will have autism by the time they're 8 years old. The first person who thought of this was Professor John McGrath in Australia. He wrote in 2001 that vitamin D deficiency should be a candidate risk factor for the neurodevelopmental disorders. And it was reading John McGrath's papers that led me to publish the papers I have about autism and vitamin D. And I'm not going to go over much about autism other than it appears before the age of 3. It is characterized by a number of autistic symptoms. They have stereotype behaviors and interests, and the phenotypic expression, that is how the gene presents itself, is widely variable. The 5 most striking epidemiological features of autism is that there's a high monozygotic to dizygotic twin concordance rate, meaning if one identical twin has it, there's a good chance the other identical twin will have it. But even among identical twins, there's widely varying presentations of autism. The other thing is males are 4 to 5 times more likely to get it than females. As you've seen, the incidence rate of autism has skyrocketed in the last 20 years. And the 5th is that dark-skinned immigrants move away from the sunny equator, their chances of getting autism starkly increase. So any theory has to explain these 5 striking epidemiological features of autism, not just 1 or 2 of them, but all of them. It's important to understand that in Somalia, autism has no name. In the Somali language, there's no name for the disease autism. However, Somali immigrants to autism in Sweden call it the Swedish disease, And the immigrants in Minnesota call it the American disease. That is, it appears that autism does not exist in Somalia, but it exists when these dark-skinned immigrants move to more poleward latitudes. The autism is vitamin D is a neurosteroid, and neurosteroids are good candidates for genetic environmental interactions. And it's important to remember that vitamin D has as many mechanisms of action as genes it regulates. And something like up to 5% of the human genome is directly or indirectly regulated by vitamin D. So it just depends on what gene is being regulated about what disease is being affected. There's a number of facts about autism that any theory has to explain. Why are children born in March more likely to have autism? Why are children born in urban areas and raised in urban areas twice as likely to have autism as those in rural areas? Why are children in cloudy areas at a higher risk for autism than children in sunny areas? Why has the incidence of autism skyrocketed in the last 30 years? And why is the prevalence of autism so high among dark-skinned immigrants who move to more poleward latitudes? Vitamin D, of course, explains all those facts very nicely. There was another study since my original paper was published that showed that metacarpal bone thickness in autistic children is less than metacarpal bone thickness in typically developing children. Another fact that's consistent with the vitamin D theory. And Kinney and colleagues in 2010 expanded on my theory and pointed out that vitamin D, one of its mechanisms of action is to upregulate genes that control proteins that repair DNA. And Kinney and his colleagues at Harvard issued a plea to immediately take steps to prevent maternal vitamin D deficiency. And in 2012, led by senior author Professor Christopher Gilberg, Kovacs reviewed the work on autism and vitamin D and called for urgent research, and those are her words, urgent research into the theory. And they found 4 studies of vitamin D levels in autistic children, all finding them low. And they do not take adequate vitamin D supplements to make up for this deficiency. Gilberg listed multiple mechanisms of action, and I refer you to his paper in which vitamin D appears to affect neurodevelopment and brain development. We're going to talk about a few of them, but there's multiple mechanisms by which its neurosteroid functions are shown. I'm going to skip this slide. Recently, Bill Grant and I published a paper. We looked at surface UVB radiation and the incidence of autism prevalence in the United States by state. And as you can see, the more UVB that a state gets, the lower the incidence of autism. And the R value was pretty high, and it went from a low of about incidence of 3 to about quadruple that. So this is compatible with vitamin D deficiency during pregnancy, but it's also compatible with what I think is more common, and that's vitamin D deficiency during ages 12 to 18 months. There's a very interesting study by Mustafa in 2012 where they looked at vitamin D in autistic patients in controls. And although the parents reported the same amount of sun exposure for these children, the children with autism had much lower vitamin D levels. This may be due to genetic, the fact that at low vitamin D levels, much of vitamin D levels are heritable. That is, they're inherited. It's only when you get to higher vitamin D levels or vitamin D levels become environmentally or sun exposed explanations hold. More interesting, they looked at an anti-neural antibodies. There's been at least 9 autoantibodies to the brain identified in autistic children. They looked at one called anti-MAG antibodies, and they found an extremely high correlation coefficient, negative 0.86, between serum vitamin D levels and the levels of anti-MAG antibodies. They also found a very strong correlation between severity on autism rating scales and 25 OHD levels, perhaps implying that if one was to increase 25 OHD levels in autistic children, the severity of their symptoms would reduce. Now, there's a study at Moffitt looking into this very question, and I helped write the protocol for this study. It's an open trial of high-dose vitamin D in autistic children. They're currently recruiting, and it's will be interesting to see. I've been running an autism tele-educational sessions for the last 18 months through the Vitamin D Council, and I've noticed parents report really dramatic improvements in about 25% of the children, significant improvements in about 50% of the children, and no improvements in about 25% of the children. The things that seem to predict responsiveness are milder autism, younger ages, distinct seasonality of symptoms, and several other things that predict response. These are the 4 peer-reviewed papers I published on vitamin D and autism, and 3 of them are open access, and I think they're all found on the internet. This last one is not yet available in PDF, but it will be in a couple of weeks. But just if you Google autism and vitamin D, you'll get 2 million hits. And if you autism Cannell and vitamin D and autism, you'll get something like 30,000 hits. But there are some good review articles online, including Scientific American and Psychology Today, that explain the theory in detail. So that's the end of my presentation. Thank you very much, and now I'll open it up to questions.
All right. Thank you very, very, very much. I am going to quickly show one slide here that we show before we ask our people questions. One of the most frequent questions we get, no matter who is speaking, is how much do I take? And based on our own research, where we had more than 3,000 people in a study, we showed a very simple chart here as their responsiveness based on where they started. If you take a look at where that arrow points, if you're starting at 20 nanograms per milliliter and you want to get to 50 and you weigh 150 pounds, it's going to take you upwards of about 4,000 IU a day to get there on average. It might take more, it might take less. There's considerable variability. And our recommendation is always that you test. But I think one of the key things, and John Cannell or Dr. Cannell may speak to this as well, is that even the Institute of Medicine, which is an extremely conservative body, has indicated that 10,000 international units a day is considered the no adverse effect level. So there's a significant margin of safety there for all of you. Now, Dr. Cannell, how does vitamin D work? That's a big question.
There are multiple mechanisms of action in which vitamin D works. One mechanism of action is the upregulation of antioxidants in the brain, including glutathione, a master antioxidant. Also, vitamin D has anti-inflammatory actions. And those anti-inflammatory actions are rather profound, and it appears that autism is a disease of inflammation. There's quite a bit of mitochondrial dysfunction in autism, and vitamin D has been shown to mitigate mitochondrial damage in renal models of mitochondrial damage. There are cells in the immune system called T regulatory cells, and T regulatory cells are the cells that prevent autoimmunity. That is, they prevent your body from making antibodies to itself. And of course, if you make antibodies to yourself, you have autoimmune disorders, and there are 9 autoantibodies that have been detected in autism. Vitamin D also upregulates neurotropins like neurotropin growth factor and a number of other neurotropins. It also upregulates at least 5 enzymes that code for proteins that repair DNA. And it also has an anti-seizure effect. So there's lots of reasons why we would think vitamin D would have effects on ongoing autism, not just the prevention of autism, but why it might help people with autism.
It sounds like you have also addressed a good deal of question number 2, Dr. Cannell. What are some possible biological mechanisms for vitamin D's effect? Is there anything else you would like to address with that question?
No, I think I've covered it.
All right. Question 3, can vitamin D help in the treatment and cure of autism? How long does it take to see some improvement of symptoms?
Well, in the last 18 months, I've been running this autism teleeducational session with parents, and my impression so far is about 25% of the parents report their child is dramatically affected by the vitamin D. About 50% of the parents report their children are significantly helped by the vitamin D, and only about 25% of parents report there's no effect on vitamin D. So it appears that vitamin D does and can help symptoms, but you have to give it in adult doses, not the 400 or 1,000 IU doses that most people recommend for children. You have to take considerably more than that.
Can you speak to how long it takes before they see some improvement in symptoms?
It depends on how quickly they get their 25 OHD levels up to lifeguard ranges. Our treatment protocol at UCSF at Moffitt is simply to get a baseline vitamin D level, then give a set amount of vitamin D, measure the 25 OHD level again, and then up the dose of vitamin D until we get levels around 80 nanograms per milliliter, which is in the reference range of 30 to 100, and it's about what lifeguards have at the end of summer in the United States.
Thank you for focusing on the serum level. That is one of the things that we focus on most, which is, as you mentioned yourself, we don't know what the dosage is. We have to measure to find out what the serum level is. Number 4, can vitamin D help a severely autistic 6-year-old?
It could, but I can't promise it will.
Right. Number 5, I think, has already been answered. It depends. And number 6, is vitamin D helpful for Asperger's?
A number of parents with Asperger's children have told me that their symptoms have improved significantly with vitamin D, so the answer to that question is yes. But again, 25 OHD levels need to be in the upper ranges of normal, not 30 or 40 nanograms per milliliter, but 70, 80, or 90 nanograms per milliliter.
Thank you. On number 7, how can vitamin D help a 7-year-old child with autistic tendencies who has no other diagnosis for her extremely slow development?
Yes, I think that probably will, but I don't know. The real question is, why not try it? What do you have to lose? As Carol pointed out, the doses we're talking about are safe, and the levels with vitamin D, levels are doses. So we're keeping the levels in the normal range. So really what you're asking, is there any reason I should not get my child's vitamin D level up to lifeguard levels? And the answer to that question is there's no reason you shouldn't. You've got nothing to lose. So when you do a risk-benefit analysis, there's basically no risk, and there's a potential for enormous benefits.
On number 8, could other environmental factors like pesticides, pollutants, heavy metals, vaccinations, and infections play a secondary role by having a bigger impact on vitamin D deficient mothers and infants?
Yes, although with air and water pollution, which some people blame for the autism epidemic, if it was air and water pollution, then the autism epidemic would have occurred in the 1950s and the 1960s. Many of my listeners are not old enough to remember, but back in the 1950s, you could see the air you were breathing. It was that polluted. And the water was, the lakes were dying from acid rain. And John Kennedy introduced the Clean Air and Water Act, and Lyndon Johnson put teeth into it. And so there was widespread and and severe air and water pollution in the 50s and 60s, yet we had no autism. So how air and water pollution could cause it now when the air and water are so much cleaner, I don't know. But the answers are there are other things like BPA, for example, in plastic bottles, and there are other toxins in the environment that could be associated with autism, and they basically act by using up glutathione, injuring DNA, increasing inflammation, all things that vitamin D has effects on.
Are there other brain developmental and behavioral disorders in children that have been linked to maternal or infant vitamin D levels? That's a big one.
White House is, yeah, it is. White House's group in Australia has found that maternal vitamin D deficiency is associated with language difficulties at age 8 and with abnormalities in an attention switching subscale at age 8 too. But this is maternal vitamin D levels. More and more, I think it has to do with the fact that infants have fairly high vitamin D levels if they're formula fed. If they're exclusively breastfed, their vitamin D levels are lower unless the mother's taking 5,000 or 6,000 units of vitamin D a day or sundays. But even breastfed infants get tremendous amounts of formula, which has quite a bit of vitamin D in it per pound. But what happens to those children when they're weaned? They're weaned more on fruit juice, which has no vitamin D in it. They're not weaned on cow's milk like we used to be. So they around age of 12 to 18 months, they literally have no source of vitamin D input. They don't go out in the sun without sunblock. They don't eat cold water fatty fish. They don't have vitamin D fortified milk. And they're getting no source of vitamin D, and about 1/3 of parents report their children deteriorate between the ages of 12 and 18 months. And I think that's from vitamin D deficiency in toddlerhood.
On the research category here, is there research on post-autism diagnosis and supplementation of D3?
No, it's important to note there are no randomized controlled double-blind study. There are no randomized controlled trials. There's no open label trials. There are no case series reports. There's not even a case report in the literature of vitamin D helping with autism. It's important to understand that this is entirely based on my experience and on the theoretical possibilities that I've already presented. The only exception I would say is Mustafa's recent paper where he showed a correlation coefficient of 0.86, which is extremely high, between the severity on autism rating scales and 25 OHD levels. Now, that's just a cross-sectional analysis, and you cannot imply causation from that, but one of the possibilities is that higher vitamin D levels will help the severity of autism symptoms.
What studies are being designed to test this theory directly?
Well, there's the only study, well, there's a couple studies going on. The one I'm the most intimately acquainted with is the one at Moffitt or UCSF, where there's an open trial being conducted of high-dose vitamin D in autism. They're having trouble recruiting children because so many autistic children are now taking vitamin D. In fact, I just did a Google search for autism and vitamin D, and there were 2 million hits. And if I did a search for, so it's out there, and more and more parents are putting their children on vitamin D, but they're not putting on adequate doses of vitamin D.
We, Grassroots Health, will be initiating our Protect Our Children Now study in later this month, which I will tell you all more about later. Its aim is with pregnant women to get their serum levels up at least in the 40 to 60 nanogram per milliliter range, and then to track rates of all kinds of things as a result of the mothers or the pregnant moms having adequate serum levels. And certainly autism in later years is one of the things that we will track as well. Number 13,
Great.
Are there other brain developmental and behavioral disorders in children that have been linked to maternal or infant vitamin D levels?
Yeah, early onset schizophrenia, is
yes.
clearly associated with it. And more recently, there's been some rumbling about ADHD, or attention deficit hyperactivity disorder, which has also skyrocketed since sun avoidance. But it's unclear what's causing that increased incidence of ADHD, but schizophrenia has been fairly strongly correlated with vitamin D deficiency. There it appears to be more gestational or maternal rather than early childhood, but that's certainly not written in stone.
How many studies show autistic children have low vitamin D?
All of them that have been conducted, and the average levels are about 15 nanograms per milliliter.
Ouch.
They go to as low as 7 or 8 nanograms per milliliter in Somali mothers in Sweden, to a high of around 19 nanograms per milliliter in Saudi Arabia. But they're all below 32 nanograms per milliliter and way below the 40 to 50 nanograms per milliliter we advise at the Vitamin D Council.
Wow. All right. Other questions? What is the best delivery system for vitamin D prenatal and perinatal up to age 5?
Well, there have been a number of studies with magnesium and autism showing, and many of them showing magnesium helps autism. There haven't been any studies with vitamin K2, but it's possible that vitamin K2. But subjectively, my best results are when parents get a product like D3 Plus from Biotech Pharmacal, and they feed their children smoothies, fruit smoothies, and they open the capsules of D3 Plus and put the capsules in the smoothies because it's pretty hard to mask the taste of magnesium. And so my best results have been with D3 Plus or my own formula, Advanced D, but the D3 Plus has more magnesium in it, so I like using D3 Plus.
All right.
And you can just Google that. Anybody who's interested, just Google D3 Plus or Advanced D, and you come to it, come to those formulas.
Thank you.
They have all the cofactors that vitamin D needs to work properly, such as magnesium, zinc, boron, and vitamin K2.
I would like you very much to talk about number 16 specifically with regards to vitamin A, helping develop cognitive ability.
Yeah, there's a high dichotomy of vitamin A deficiency. In the developing world, vitamin A deficiency is a rule because they usually survive on a single carbohydrate source. In more developed countries, there's a plethora of colorful fruit and vegetables which supply all the beta carotene one needs to make vitamin A. And in addition, in the United States, there's too many foods supplemented with preformed retinol. Most recent studies show that the problem in the United States is vitamin A toxicity, and it's widespread. So do not take cod liver oil. Do not take vitamin A. If you want to take some beta carotene, that's probably harmless, but your body has all the vitamin A it needs.
Thank you. On number 18, are there other parameters beyond sun avoidance that would account for a rise in the rate of, I would say not many diseases at this point, but in autism?
Well, BPA, which is a plastic chemical that's in water bottles and the lining of cans and in used to be in infant formula, at least it seems to fit the autism curve. But of course, it can't explain all these other epidemiological facts about autism. It's important to know that there's 3 epidemics among our children in the last 20 or 30 years. There's the epidemic of autism, there's the epidemic of asthma, and there's an epidemic that's not talked about very often, but autoimmune disorders, childhood rheumatoid arthritis, childhood lupus, insulin-dependent diabetes mellitus are all dramatically increased since sun avoidance began. The other thing is food allergies, which were basically unheard of when I was a child. Now in Melbourne, Australia, 10% of the children have documented, challenge-proved food allergies. That is, they say they're allergic to tree nuts. They're brought into a doctor's office. They're given tree nuts with an ambu bag and intubation equipment and adrenaline ready, and see if they get whelps or if they have difficulty breathing. That's a challenge positive food test. So 10% of children are allergic to things like seafood, tree nuts, peanuts, gluten, casein in milk. It's just incredible. And what explains that dramatic increase in food allergies? No one knows, but it's been a dramatic increase in the last 20 years.
Thank you very much. For those that are ready to close out at 10:30, I would like to tell you about next week. Dr. Cannell will stay on to answer some more questions, but I want to briefly tell you about our next week's session. Is going to be a repeat in part of an interview with Dr. Wagner and myself, and also Dr. Wagner will be answering a lot of questions. Vitamin D in pregnancy, protect the start. We are using this next week really to focus again on pregnancy and the initiation that very same week of our Protect Our Children Now project, because if we can start before the child is born, I personally am very convinced that we can, I don't know, solve the world's problems maybe. At any rate, next Tuesday, Dr. Wagner and myself, we will be talking about vitamin D and pregnancy and protection. So thank you to all of you for coming, and if you would like to stay on for a little bit and come back to answering some more questions with Dr. Cannell, you are very welcome to stay. So Dr. Cannell, we were on this one, levels and dosage. And again, we get a lot of these questions. And if you want to answer these one by one, we're happy to do that. Or you can make a kind of a general statement about generals and dosage. I'm going to leave that one up to you.
Yeah, I mean, I think Michael Hollick's reported that he's never seen toxicity with levels below 200 nanograms per milliliter. And if you want to apply a safety factor to that, just say 150 nanograms per milliliter, although I'm not aware of any cases that show documented toxicity with 150 nanograms per milliliter. But, that said, you can give too much vitamin D. Vitamin D is safer than water, though. I mean, many more people die from water intoxication every year in the United States than die from vitamin D toxicity. In fact, I don't think there's been a documented death from vitamin D toxicity since the 50s. So, but hundreds of people, if not thousands of people, get sick or die from water intoxication. So vitamin D in many ways is safer than water.
I would like to interject one thing here, Dr. Cannell. In our study, one of the things that we found was very interesting and should help with the toxicity issue is that when a person gets to the, I don't know, in the 40 to 50 nanogram per ml range, even though they might be taking a lot and continue to take more, the incremental change in their vitamin D level as a result of taking another 1,000 IU per day is not 10 nanograms per milliliter. It might be as low as 2. So that whole curve flattens out. So it's hard to get toxic with vitamin D.
Yes, unless you're taking 100 or 200,000 units a day. I took 200,000 units a day for 6 months in an attempt to make myself toxic. I just wanted to see what it was like. Of course, I checked my levels and checked my serum calcium and my urine calciums, etc. But it was very hard to get. I think my levels got up to 400 nanograms per milliliter, but my serum calcium and my urine calcium to creatinine ratio didn't budge. They were normal the whole time.
Interesting.
We're not recommending this. Yeah, right. Don't do this. This was because I wanted to experiment on myself. So don't do this.
Right. And I think the recommendations on the rest of these questions really for pregnant women and young children and whatever are exactly the same as we have been stating. Get the serum level up to that 40 to 60 range at all times.
Yes.
All right. Very specific kind of questions here. Again, we have lots of parents and children in need here. 3 sons, what dose of vitamin D would you recommend and in what kind?
Well, dosage of vitamin D should be based on body weight, and children of that age have adult body weight, so I would give them all 10,000 units a day. But I give 5,000 units a day as D3 plus, which is 3 capsules, and then 5,000 units a day as a 5,000 IU capsule. So that would be my recommendation: 3 capsules of D3 plus and 1 capsule of 5,000 IU of vitamin D.
All right. Of the rest of these questions, Dr. Cannell, would you take a quick look at them and see which ones need any specific answers other than the serum level that we've already been recommending?
Yeah, parents want to know how much should I give my kids to start with, and anywhere between 1,000 to 2,000 international units per 25 pounds of body weight is a good place to start. Then the half-life of 25 hydroxy vitamin D is about 6 weeks, so you want to wait 3 half-lives, or about 3 months, to get a 25 OHD level, and then you want to increase the dose till you get your 25 OHD levels up to the high range of normal.
And I think one of the key things that is in that statement there is people need to test. We really can't tell at this point in time when you take a particular dose what the level is going to be. All right?
Right. Body weight predicts some of it, but by far the highest predictor is genetics.
Right. I like question number 30. Have there been any accidental overdoses of vitamin D in autism that serendipitously indicated rapid recovery?
Yes, there have been 3 cases that I had in which parents, instead of giving it 3 drops of vitamin D from some sort of vitamin D compound they gave 3 dropperfuls. And there's something like 30 drops in a dropperful. So these kids were getting 10 times more vitamin D than I wanted. And in all 3 cases, there was a dramatic and remarkable improvement in symptoms. So it may be that in the future, we will not just get 25 hydroxy vitamin D levels up to 80 nanograms per milliliter, but we'll get them up to 150 nanograms per milliliter.
Mm-hmm. Is there any reason, this question is not on this particular page, Dr. Cannell, is there any reason to not recommend 5,000 IU per day per 100 pounds of body weight?
No, I don't see any reason not to, and that's very close to Robert Haney's recommendation of 70 to 80 international units per kilogram of body weight, which is what he recommends to get a level up to 40 or 50 nanograms per milliliter. So 5,000 international units per every 100 pounds of body weight is good. At the council, we just recommend 5,000 units a day because people want an easy thing to remember, and 5,000 IU capsules are now widely available at any pharmacy, at least in California.
Right. With
it's important.
Go ahead.
It's important to note that there's no vitamin D in breast milk unless the mother sunbathes or takes 4,000 to 6,000 units of vitamin D a day herself. It's one of the mysteries that always confounded me when I was in medical school. Why would nature's perfect food not have any vitamin D in it? And the answer is it doesn't have any vitamin D in it because virtually all the mothers are vitamin D deficient. That's the answer to the question. If a mother sunbathes, that is out in the sun a lot, she'll have lots of vitamin D in her breast milk. So that's the natural state, is for vitamin D to be in breast milk. The unnatural state is for it not to be in breast milk.
I think the other important thing. Go ahead.
If you're breastfeeding, make sure you're taking at least 6,000 international units of vitamin D a day.
And on that case, it's very important to take it daily, whereas if it's just for your own benefit, you can actually take it weekly and it doesn't matter, but it actually goes through the breast milk as D3 and not as 25 OHD. So it's very important to take it daily, which is good. Another question here, which we run into a lot, and I'm sure you do too. It says, my OB says my prenatal is sufficient for my vitamin D requirements, and it has 400 IU. I hate to go behind her back and supplement without her consent. Any advice?
The OB doesn't know what he's talking about. 400 units a day is not going to raise a 25 OHD level of a pregnant woman more than 1 or 2 nanograms per milliliter. Pregnant women need 6,000 units of vitamin D a day, so you need to take your prenatal vitamin plus another 6,000 units, 5,000 for the mother and 1,000 for the developing infant. And that's a minimum suggestion. It may require more, but that's a good place to start. So 5,000 units a day.
The publication by Hollis and Wagner et al., Carol Wagner's study that is referred to on the safety and effectiveness of vitamin D can be downloaded from our website, and you could actually take that to your doctor. Because one of the things that they use, other than just not knowing, is they're concerned about the safety. And that's a good study, and they very clearly showed in there that the 4,000 IU that they gave to these pregnant women was totally, completely safe. So that's
Yeah, and
one thing that could be done.
they also had to terminate their 2,000 unit arm early because their ethics committee decided that they saw that 2,000 units a day in lactating mothers did not adequately raise 25-hydroxy vitamin D levels in the suckling infants. So their ethics committee made them stop the 2,000 unit a day arm and only proceed with the 4,000 unit a day arm.
Fantastic. There's so much out there, isn't there? I mean, it's just kind of like we've
Yeah.
got to get on with it.
Yeah.
All right.
Well,
A
I've
few
been
other
trying to get
questions.
on with it for 11 years now, and it's starting to catch on. I mean,
It
you know, you
is.
have to take the victories where you see them. Just the amount of vitamin D that's available in stores, the availability of 5,000 IU capsules. When I started, there was only 400 IU capsules. The amount of research that's coming out, phase 2B randomized controlled trials that are coming out, and all kinds of diseases is something new. Um, the ongoing studies of vitamin D and cancer and heart disease are undergoing now. So a lot is happening. And multiple sclerosis is one field where neurologists are scrambling to get their multiple sclerosis patients on vitamin D. So things are changing. They're not changing as quickly as I'd like it, but they're changing.
That is true. On this page, there mostly, I believe, Dr. Cannell, you have answered most of the questions on this page, but number 36, are there any other supplements that you recommend in autism?
Well, there have been some other studies. Magnesium has been studied the most, and it seems to show a favorable treatment response. That's one of the reasons we recommend a complete vitamin D formula, because both of them have magnesium in it. There have been fewer studies on isolated B6, but some of them show that there's an improvement in symptoms. There's one double-blind placebo-controlled study showing fish oil helps autism, so I recommend all my patients take a concentrated fish oil. I also put them on potassium just as a general precaution because potassium intakes in adults and children are woefully inadequate in this country. You have to eat 6 to 8 servings of fruit and vegetables a day to get adequate potassium intakes, and nobody does that. And then there are a couple of studies, randomized controlled trials, that showed multivitamins are helpful, but it's important that there be no preformed retinol in the multivitamins. So look on the multivitamin. If you see the word retinol acetate or retinol palmitate, do not take it. If you see beta carotene, that's probably not going to do any damage. But if it says acetate or palmitate under vitamin A, do not take that multivitamin.
Thank you very much. Numbers 39 and 40. Are you starting an online teleeducational session for parents? And do you diagnose and treat autistic children in your office? Please update us on those.
Well, yeah, starting in September, I'm going to be diagnosing and treating autistic children in my office. But also starting in September, I'm starting a fee-for-service teleeducational program in which I educate parents about vitamin D and other supplements useful in autism. The business model is one my accountant sort of shivers at, and that my business model is a money-back guarantee. If the core symptoms of autism don't improve, then the parents get their entire fee back. So we'll see if I'm broke in a couple of years or not.
Only if you spend it.
Yeah.
Dr. Cannell, I truly admire everything you've done, or I don't know everything, but I truly admire your whole career and the things that you have done. When we first met back in 2007, when I started my advocacy journey, you were an immense help then, and over the years, I have been very excited to watch all of the development things that you do and appreciate your working with us as you currently do. So thank you so very much for coming
Well, you're
and doing
welcome, and
this.
I just want to mention Well, I just want to mention we have a brand new website that's less than a week old. So if you just Google Vitamin D Council, you'll come to the new website, and we hope it's a lot more user-friendly than our old website. It's been about 2 years in the making.
Thank you, and it is a beautiful one, and to everyone, it's full, jam-packed full of fantastic vitamin D information. Again, next week, thank you very much for attending today. And for next week, we will be talking again about pregnancy and vitamin D and protecting the start. And we always, of course, encourage you to help sponsor the webinars. And the biggest sponsors we've got are those that have enrolled in the study and or enrolled their friends in the study. So have a beautiful day. Thank you for coming and take care of yourselves.
Thanks for
Bye.
having me. Bye.
You bet. Thank you.